The last thing we may need to mention on the skull is the mandibular fossa right here, where you have your TMJ, the temporomandibular joint, which is where your mandible, which is the lower jawbone, articulates with the skull. Okay, so here we have another mandible that is disarticulated, so we can look at that separately. Okay, so we have, this is the mandible, we have the body of the mandible, and then we have the angle of the mandible, and this is the ramus of the mandible. This portion in the front that sticks up is called the coronoid process. It looks to me like a shark fin, so I always tell the students you're paranoid of the coronoid, like you're paranoid of a shark getting you. And this portion in the back that articulates with the skull is the mandibular condyle. Okay, that's actually the part where it goes into the skull. So we have mandibular condyle, the coronoid process, and again, we talked about the mental foramen already, the hole in the front. And if you put your fingers in between the coronoid process and the mandibular condyle, you end up in another little tiny hole here, and that would be the mandibular foramen. And that's if you go to the dentist. I would say you have nerves and blood vessels coming in and out there. If you go to the dentist and they give you, if you have to have a cavity filled on your lower jawbone in your mandible, they give you a shot way, way back in the back of your head, it feels like, and that's because they're giving you a block in your mandibular foramen, and that would de-innervate or anesthetize the entire mandible all the way to the midline. Sadly, it does not work that way in the maxilla, but in the lower jawbone, it does.